Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Work toolkit. I will now report our current case counts. There are 105,935 confirmed cases of COVID-19 in Canada and 35,948 cases in Ontario. Chatham-Kent has 162 cases and Sarnia-Lambton has reported 286 cases. Michigan now has 66,173 cases, with 11,728 cases being in Detroit. Today, we are reporting 1,678 cases of COVID-19 in our community, an increase of 6 cases from yesterday. 1 is a farm worker, 2 work in Michigan, and of those, 1 is a healthcare worker, 2 are community cases, and 1 is still under investigation. 1,038 cases have now resolved. 537 people are self-isolating. 25% of our cases are between the ages of 20 and 29 years. 23% are between the ages of 30 and 39 years, and 17% are between the ages of 40 and 49 years. 63% are male and 36% are female, with 1% unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care homes experiencing a COVID-19 outbreak, and there are currently 5 workplaces in the agriculture sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath. Call 911 if you have difficulties breathing and are struggling to breathe or speak, or are experiencing severe chest pain, feeling confused, or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Ahmed, our Medical Officer of Health, for further updates on COVID-19.
Good morning and thank you again for joining us. First, I want to start by noting that our entire region has now moved into stage 2. Premier Doug Ford made the announcement yesterday that Leamington and Kingsville will join the rest of Windsor-Essex and the rest of the province in stage 2 reopening, enabling more businesses to open their door once again for customers. To assist these businesses in their plan for reopening, there is a reopening toolkit on our website. Sample signage and countless guidance document and checklists for safe reopening are available on our website www.wechu.org to access these resources and many more resources for COVID and other related guidance documents. Communities across the province have and continue to grapple with COVID-19 pandemic. However, we must not lose sight of another public health crisis that continues to unfold. Opioid use and overdose persist as a growing public health concern. In May, there were 33 confirmed opioid-related overdoses visits to the emergency department in Windsor-Essex. Since the beginning of June up until June 21st, we have had 21 confirmed opioid-related overdose visits to the emergency department. As well, drug-related emergency department visits for the first quarter of 2020, that's from January to March, were higher than the same timeline compared to 2018 and 2019. This information does not capture the number of people who utilized the naloxone kit and did not call 911. We know through verbal reports from community partners that naloxone use is increasing as well as the number of overdoses responded to in the community. Stress, anxiety, and isolation experienced during the COVID-19 pandemic can have a negative impact on substance use, including relapse and or increase in use and or risk for overdoses. Combine these stressors with less access to services including mental health and addiction, primary care providers, and positive social supports, individuals struggling can quickly develop problematic use that could result in overdose. People who use opioids and or methamphetamine are also at increased risk for COVID-19, as these drugs slow their breathing and can cause respiratory damage. Group-based support and social connectedness is a key part of recovery for substance use disorder. Many services have changed or been disrupted during COVID-19, which can make navigating a difficult system that much harder. For individuals seeking help or support for substance use disorder, talk to your primary care provider about treatment options. And support. Visit the Mental Health and Addictions Urgent Care Center located at 1400 Windsor Avenue, or call 519-257-5111 extension 77968, or call Family Services Windsor-Essex Support Services at 1-888-939-1831. If you are in crisis, please call 519-973-4435. For more information on supports and resources related to substance use, visit the Windsor-Essex Community Opioids and Substance Strategy website at www.wecoss.ca. For individuals seeking harm reduction supplies, please visit AIDS Committee of Windsor at 511 Palliser Street. To prevent overdose and protect yourself or a loved one during COVID-19, practice physical distancing and do not use any drugs alone. Carry a naloxone kit. Do not share pipes, needles, or other equipment for substance use. Wash or sanitize your hands before and after every drug use. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Windsor.
I just wanted to clarify some of the terminology used. One question we're always getting from readers is when the daily updates are given, it's usually said that a number of cases are in the community, such as today 2 cases are in the community. Does that mean community spread, or is that just to differentiate community from the other types of sources, such as agri-farms?
Okay. Yeah, when we're saying those cases are from community, that means that's from a result of a community spread where we cannot link the cases back to any specific case or identify it as a close contact. So essentially, this person acquired COVID-19 through mechanism that is unable to differentiate from a confirmed case, which means that there is a risk to the community for those people who may be coming in contact with cases and are spreading it.
Okay, thanks for clarifying.
Any questions from the Windsor Star?
Yes, good morning, Doctor. With Kingsville and Leamington moving into stage 2, do you have any more concerns about those communities reopening than you may have had about the other regions in Windsor-Essex?
I think what we are seeing right now in Leamington and Kingsville, and we were keeping a very close eye in terms of what is happening in the farm and what is happening outside of the farm. And the cases where they're originating, the workers where they are self-isolating, and what the risk to the general community. So we were carefully monitoring all those numbers and data, and over the time we know that all these cases are limited to these workplaces or to these agri-farm sectors, and their community cases are pretty much comparable to what we are seeing in the rest of the Windsor and Essex. So based on that information, and with the additional support from the province in containing these agri-farm outbreaks, it seems like it's well under control in that sector, and the negative impact of having a social and economic disruption in the society balancing those risks. I think that's moving in the right direction to provide the support that the community needs.
Thank you.
Any questions from CTV?
Yes, hey Doc, just curious, people are already talking about stage 3 now that everybody's in stage 2. So how much needs to be done to be proven in stage 2 to get us to stage 3? Is there discussion about stage 3? Is there a timeline for that kind of thing?
Hi, Bob. I think those questions are always asked, and what we can say at this point, obviously, the province is using their own matrix and decision-making criteria for to move to take one community from stage 2 to stage 3, and so on. But from a data perspective, what we will be interested in locally is as more and more businesses are opening up and more relaxation in terms of the physical distancing, or the number of people who are congregating together and businesses opening up. We'd like to see that it's not contributing to new cases or further spread of the disease. And we may still see some of these cases in the community, but as long as with these some of the relaxation, if you're not seeing that much of a big increase, I think that would be a good indicator for us to say that we are ready to move in the right direction. And most importantly, we need support and compliance from everyone, every individual in our community, every businesses, to ensure that they have all those systems in place for us to safely move to stage 3 and beyond. And that definitely requires support and cooperation and understanding of each and every individual in Windsor-Essex.
So we're talking a little bit of time here. It's not like it's going to, it's going to switch and then, oh, next week let's go into stage 3, right? Like it's going to take some time here.
Well, I think we have to look at data, and sometimes at least 2 to 3 weeks worth of data gives us a picture of what's happening. So I would say that by the time when we move to stage 2, we'll have to give ourselves some time to see what the impact is. And as we know from COVID, the impact typically shows up after 2 to 3 weeks of any intervention. So we'll expect to see if what kind of an impact that the community has seen based on the stage 2 reopening, and what does it mean for us, and if things looks okay, I think it'll be a good indicator for us to continue to move into more relaxation of and more opening of the business.
Okay, thanks, Doc.
Any questions from CBC?
Yes, good morning. I was wondering if we have numbers on how many farms in Windsor-Essex have done on-farm testing.
I don't have that number, but I can say it will be close to 40 or so that have done at least most of, if not all of their staff tested.
And is there more to come still? More farms that are still going to go ahead with that?
Well, that's the plan that everyone is working on, and also to ensure that what we have seen with the more recent one is some of that is stabilized, and then there is a capacity in the system to test all those people, and if needed to isolate them or to put them in isolation units, we have the capacity as the region, as the health unit, and also as the health system to meet that. Right now, we have seen all variation. We have seen farms with no cases, we have seen farms with some cases, and we have seen some farms with a lot of cases. So I think we're working towards that goal, to make it available for every farm to go through the testing. And some of the benefits that we can see is, if you're early identifying some of these cases, because otherwise if they are not reporting any symptoms, or if they're not reporting back to the public health, and through this testing, if we identify those cases earlier on, we can put strong controlled measures for it to spread further and potentially avoid any major disruption in the farm operation from that perspective. So I think we're all working for the same cause, and hopefully we will have everything in place to get through all the testing, whoever wants to get tested, done in a timely manner.
Thank you.
Any questions from Blackburn?
You spoke about the numbers of opioid reports that you had in May. Do you have any figures to compare them to, like, the previous year? Were we counting these at that point?
For the overdoses, yes, we do have some of that data available on our website, and also if you go to www.wecoss.ca, we'll have more details. But the number that I presented is just like a snapshot of what is happening from a big picture perspective. Any further detail should be available on our website. If not, and if you're looking for specific data, feel free to connect with us, and we'll provide you with that information.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, for the confirmed cases of overdoses, does that include individuals that were rushed to Erie Shores and Leamington as well, or is that just Windsor hospitals?
No, our database that we use, it covers all the emergency department in our region, so that covers Windsor Regional as well as Erie Shores. But one caveat that I mentioned is these are all the individuals who ended up in the emergency department and called 911. There may be a situation when people or individuals experience overdose, and a naloxone kit was used to revert them, and that's we have heard from our partner that the number is increasing where some of the family, friends, or agencies had to use naloxone. So I think that's definitely something concerning, and identifying that some of these issues are linked with social isolation and some of the challenges, the economic, social challenges that everyone is experiencing right now, and individuals who have some issues with substance use or at a higher risk of using substances, they are particularly at higher risk. So the message is for all of us to ensure that if we have someone or if we know someone who used substance for any reason, now is even more important for us to care for them, to ensure that they are safe, and if they are still using or if they choose to use substance, they're using it safely and they have all the right resources available to prevent them from developing any complication.
When it comes to naloxone, I believe LaSalle Police, they issued a advisory a couple of weeks ago where they administered it on two occasions in the same week. One individual is going to recover, the other one passed away. When it comes to the kits, are you still in communication with the chief of Windsor Police about naloxone?
Well, at this time, I guess COVID is taking over everything, so I can't say that that conversation is going right now. But I think through our Windsor-Essex Community Opioids and Substance Strategy, we are in touch with all of the partners through our communication, like media, email communication, and some of the things are ongoing, and some of the work that our partners are doing, they're doing an excellent job in having some of these resources and services available for them. But clearly, I think as we work along our way with COVID-19, we need to focus on some of the other issues that are already affecting our community, and all of those issues will be addressed appropriately.
Thank you.
Any further questions from Windsor?
No, thank you.
Windsor Star?
No, thank you.
CTV?
I'm good, thanks.
BBC?
No, thank you.
Blackburn?
No, thanks.
AM 800?
No, thanks.
Thank you, everyone.
Thank you.
Thank you.